Okay, good morning, everyone. Thank you for joining us here for the Governor's Committee. And so we are going to have a webinar talking about housing. So we do have some other programs I'm sure you all know that are relative to what we do. And so we're going to be talking specifically about the Health and Human Services resources, what we have for housing. So we are coming in today to do the special presentation regarding the services that we have available for housing. So we're very happy to have you all here to participate and to get some more information about this program out to you. So now just some housekeeping rules. We don't have the chat available today, so if you do have any questions, go ahead and type those out. You can have that typed. If you want to ask on the toolbar, you can see that toolbar. There's some ability for you to put in questions there on the toolbar. So if you have any comments or questions, we'll be checking there. And then in addition to that, we have interpreter access and captions. So you can go down to the toolbar and see how to access the interpreters, and you can also accommodate your Zoom settings best to you, how that works for you. And then finally, I just want to mention that we will also have the option for you to fill out a survey once this is over. And we always appreciate getting your feedback so we can make improvements for this presentation in the future. Also, you will be getting an email from us with the link for this recording, this presentation, and PowerPoint and all of that. So that link will be available to you. And also, if you'd like to fill out the survey at a later date, that will be made available on the email. So thank you so much for coming today. And now I'm going to go ahead and turn it over to you guys to get this started.
Thanks, Matt. My name is Claire Benitez. I'm from the Health and Human Services Commission. I'm the director of the Office of Disability Services Coordination. Thank you to the Governor's Committee for People with Disabilities for inviting us to present today. The Texas Health and Human Services Commission supports housing for Texans through a variety of information, referral, and support services designated to promote independent community living. While HHS is not a housing agency, it works closely with state and local partners to connect individuals with housing resources and programs that can help address housing needs, particularly for people with disabilities. You may be familiar with various agency plans that may include HHSC efforts in housing coordination and support. Some of the projects and efforts might be reflected today in agency plans that include housing, such as the Promoting Independence Plan, or PIP, where we coordinate with the Texas Department of Housing and Community Affairs, Texas Workforce Commission, our Department of State Health Services, and the Department of Family and Protective Services. This session today will provide an overview of HHSC housing-related resources and programs, including 211 Texas, behavioral health housing supports, Medicaid housing-related supports, Aging and Disability Resource Center, area agencies on aging, and independent living services. Attendees will learn about available housing resources, community-based supports, and referral pathways that help people locate, access, and maintain housing in Texas. While HHSC supports these parts of housing, TWC, or the Texas Workforce Commission, and the TDHCA, or the Texas Department of Housing and Community Affairs, support housing in various ways. At the end of the presentation, we'll share some general information. Let's get started with 211. Next slide.
Good morning, everyone. I am Clea Dominguez from Health and Human Services 211 Texas Information Referral Network. I'm their manager, and today I will be providing an overview of 211 Option 1, or Information Referral Services, and how we can help connect individuals to housing resources. Right. The 211 Texas Information Referral Network, also known as 211 Texas or 211 Turn, helps Texas citizens connect with the services they need. 211 Turn collects and organizes information about state and local health human services programs such as housing, food, medical, mental health, and transportation services, and much more. Services are offered via phone, web-based chat, outreach services, and online at 211texas.org. Our services are 24 hours, 7 days a week, 365 days per year. We also encourage individuals with disabilities to use the Relay Texas line by calling 711 or 1-800-735-2989 so they can use the appropriate accessibility tools and then request the Relay Texas to be connected to our toll-free line 877-541-7905, option 1. This will help individuals with disabilities and our agents be able to connect to provide the information being requested. 211 Turn maintains a single statewide number by either dialing 211 or that toll-free number, and a single statewide database for consumers to be connected to comprehensive information and referral services. The database supports an information directory and also customer relationship documentation to address community needs across the state. If an agency would like to add or edit services to our 211 database, we do have a link on our 211texas.org website where they can connect with a local area information center resource manager to provide information about their services or update that information. And our services are administered primarily through 25 competitively procured information and referral contracts. And we also have multiple emergency service escalation centers that support the dissemination of information during a disaster. When dialing 211, the caller selects the language, and then they're offered numerous options, including information on state benefits and the opportunity to report waste, fraud, and abuse. The options that will connect callers to 211 Texas information referral is mainly option 1 and option 5. Option 1 provides comprehensive information on services within the caller's area, and option 5 focuses on referrals for mental health and substance abuse support. We also have option 4, which aids the registration to the Texas Department of Emergency Management Emergency Assistance Registry. And that is a registry to help local emergency management coordinate disaster planning, especially for those with disability. We also have an option 6 line that is activated in the times of disasters to provide callers with key information regarding disasters such as evacuation routes, FEMA registration assistance, and shelter locations, or public health emergency information. As you can see on this slide, our housing referral data is a huge need request from callers. In calendar year 2025, Turn made over 500,000 housing-related referrals out of the 1.1 million need requests that we received in that year. Our top housing referrals are majority utility payments, rent payments, affordable housing, and homeless shelters. Utility payments and rent payment assistance are usually our top 1 and 2 referrals overall. Regarding housing resources and how to connect to housing resources through 211, other than our chat, phone call, outreach events, we do also have access to information via our 211texas.org website. There is a housing choice Finding a Place to Live webpage that provides an overview of various subsidized housing options statewide and is designed to help individuals navigate through these options. The availability of these housing options and services may differ from one community to the other, so not all services are accessible everywhere in Texas, but it gives individuals ideas of services that may be available. Many housing services may also have wait lists. It might not be offered in your area. So calling 211 will help be able to determine that information. The information on our Housing Choice website is general and specific to housing programs, may be different in regards to eligibility requirements. Users can also use the guided search to find housing, shelter, and services. So we have a housing and shelter category, and that is broken up into subcategories to help identify the search term that is needed to find the resources on our website. You can also visit our Get Started page for additional information on how to search for resources on the website. If you have any trouble finding resources, we also have our chat messaging available via 211texas.org. And that is it for 211 Texas. Thank you.
Next, we're going to hear from the Behavioral Health Services Division about the different housing-related programs and supports in their area.
Good morning. My name is Yvonne Rivas. I am the program specialist over the Healthy Community Collaborative here with Health and Human Services. If you can go to the next slide, please. So the Healthy Community Collaborative was established in 2013. The purpose of the collaborative was to bring together both the public and the private sectors to provide people with a mental health or substance use diagnosis and who are experiencing homelessness. They wanted to bring those sectors together to support them. So HCC initially only provided services in urban communities, but it did expand into rural areas in 2017. Next slide. So this is just showing a map of these current 7 HCC providers that we have. Right now, we have 4 urban providers and 3 rural providers. But the good news is that we are expanding in fiscal year 27. So as of September 1st, we will have 11 providers, 5 urban and 6 rural providers. So this map will only be accurate until 9/1, but the good news is that the services are expanding across Texas. And if you can go to the next slide. The service array here, it includes but is not limited to mental health and substance use treatment, case management services, integrated medical care, supported employment services, supported housing, and peer services. And then, yes, in order to access your HCC provider, you will contact one of the providers, and they conduct what's called a coordinated assessment. And that assessment is basically the single entry point for individuals and families who are seeking housing and support services. So this typically involves a standardized evaluation. So the assessment will determine which programs a person qualifies for. Once they determine your eligibility, then they will prioritize those most in need of housing interventions. And then you'll be referred to the appropriate housing program and services that meet the individual's needs. So it is a great program. And in the next slide, I believe, is the contact information. So if you have any questions, yeah, that's not me. But if you have any questions, you can contact the adult mental health email address that we will provide after this section is over. And so that is all for the Healthy Community Collaborative.
Let's move to the State Hospital Step Down Program.
Hi, my name is Libby Burleson Forrest, and I am the director over adult mental health programs at HHSC. And so I oversee a couple of the next programs that I'm going to talk a little bit about today. So the first one being is a State Hospital Step Down program. The State Hospital Step Down program is designed to identify, assess, and facilitate the successful transition of adults with serious mental illness or a combination of a serious mental illness and a medical condition into the community with the appropriate supports that they're needing to be integrated back into the community. HHSC contracts with 4 local mental health providers to form an intensive transition team, which facilitates the transition process from the state hospital by providing pre-transition services and developing an individualized plan. Each step-down residence has a maximum occupancy of 4 to 8 beds and offers 24/7 assistance. And so the state hospital step down program, again, is really designed to transfer people who have been in the state hospital for over 365 days back into the community. You can stay in the state hospital step down program for up to a year, where you can learn basic living skills to transition to independent living. Go to the next slide. So the state hospital, the referral process, how do you get referred to a state hospital step down program? So the state hospital team identifies people who are ready to discharge but have barriers preventing them from transitioning into the community. The transition specialist reviews the referral to ensure the referral is complete. The person is actively engaged in recovery and meets all admission criteria to include the ability to evacuate without assistance, medical needs don't exceed available resources, and no recent aggression or self-harm. And on the right side, you can see where our current state hospitals are located. Next slide. Here are our current state hospital step-down homes. We've got one in Helen Farabee, 2 or 3 with Bluebonnet Trails, and one with the Harris Center. We are expanding to San Antonio and Nipah, but those homes are not currently operational yet. Next slide. The next program that I'm going to talk about is the Supportive Housing Rental Assistance. So Supportive Housing Rental Assistance provides funding to local mental health and behavioral health authorities to enhance their ability to provide rental assistance, utility assistance, and necessary deposits and moving expenses. Supportive Housing Rental Assistance is available for up to 12 months. And it is for people with mental illness who are either homeless or at imminent risk of becoming homeless. Currently, we have a total of 36 providers out of the 39 LMHAs. Next slide. In order to be eligible to receive supportive housing rental assistance, people will have to be assessed by a local mental health or behavioral health authority for a full level of care. So this is the adults needs assessment that's done for anybody receiving services at a local mental health or behavioral health authority. You have to be 18 years old, have to have a diagnosis of a mental illness, be homeless or at imminent risk of becoming homeless. And priority is given to people transitioning from hospitals that can be community or state psychiatric hospital, nursing facilities, forensic units, and to high utilizers of crisis services. Here are the current locations. Like I said, we're at 36 of 39 local mental health authorities. Next slide. The next program that is in my purview is the project for the assistance in transition from homelessness. It's commonly referred to as the PATH program. The purpose of the PATH program is to engage people with serious mental illness or co-occurring disorders experiencing homelessness and connect them with community behavioral health and primary health services. The PATH providers really are that connecting agent to ongoing services, including housing. But some of the common providers that PATH providers connect individuals to are behavioral health services, housing, education, employment supports, and primary health care services. Currently, we've got 16 PATH providers across the state of Texas, and this map just kind of illustrates where the PATH program is offered. PATH programs are offered, some of them are local mental health and behavioral health authorities, and some are independent nonprofits. And so the project access, that's not me. If you've got any questions about the programs that I reviewed, we'll have my email address, our general email address, where we can help answer some of your questions. Thank you.
Hello, my name is Brittany Hinton, and I'm a housing specialist with the Behavioral Health Strategic Integration Department. We just got realigned, so still working on that name. But I'm here to talk to you about 2 programs that are primarily overseen by the Texas Department of Community and Housing Affairs, known as TDHCA, as well as funded by. But we work very closely with these programs. So the first is the Project Access program. There's actually a mainstream as well as a pilot. They both are for at-risk, current or recently released residents of state institutions like nursing facilities, intermediate care facilities, Texas state psychiatric hospitals, or board and care facilities. Specifically, the pilot eligibility requirements are for people that are in state hospitals or have discharged in the last 60 days. They must have a permanent disability and meet the housing choice voucher eligibility. So that's that main Section 8 housing choice voucher. It speaks to the HUD income guidelines. Also, it requires strong communication between the local mental health and behavioral health authorities and referring institution, primarily because the TDHCA holds the vouchers, and so they're not ported to the local public housing authorities for at least a year. So, therefore, the community needs to be heavily involved with the referring because they don't have that piece of the local housing authority, which it seems to be easier because of course, there can be lost in transitioning from state hospital to the community in that way. Next slide. So this project actually is spoken about in the Texas Statewide Behavioral Health Strategic Plan. I believe the link is attached to the image here where you can see the PDF in totality, but specifically it addresses a few different areas like GAP 12, which is the access to supported housing and employment, as well as Goal 1, intervene early to reduce the impact of trauma and improve social determinants of health outcomes, and Goal 1.2, coordinated across local, state, and federal agencies to increase and maximize use of funding for access to housing, employment, transportation, and other needs that impact health outcomes. Next slide. And then also we have the Section 811 program, which is a rental assistance program that's designed to help adults aged 18 to 62 with disabilities live as independently as possible in the community. It offers project-based rental assistance, meaning that the subsidy is tied to the apartment rather than the tenant, and participants typically pay no more than 30% of their income for rent and utilities. The program operates through a partnership between HHSC, TDHCA, as well as the eligible multifamily property. Next slide. And to be eligible, you have to have at least one household member that is a part of the target population, so having that disability. Also, the household income must not exceed 300% of the SSI or limits established through the Medicaid buy-in, which is about 250% of the federal poverty level. Applicants exiting institutions must meet the nursing facility or intermediate care facility for individuals with intellectual disabilities medical level of care requirement, as well as people must be referred by a qualified referral agent, such as a service coordinator or case manager that's associated with the participant's waiver program. So there are actually referral agents throughout Texas that are assigned to be able to provide a referral for this program. And then we have here contact information. If you have any more questions that you may need specifics about, you can reach out to me directly in regards to project access. The 811 info mailbox is receiving all information for Section 811, and then all other programs that have been discussed under behavioral health, you can reach out to adultmh@hhs.texas.gov.
Paul, let's check in with our Medicaid representatives about housing services and options within the Medicaid division and waivers.
Good morning. My name is Kate Lehman, and I'm a Director of Program Policy in the Medicaid and CHIP Services Division Office of Policy. So I'm going to talk with you a little bit about some of what is available in our different Medicaid programs. One thing that I do want to note up front to just sort of frame all of our discussion is a reminder that Medicaid itself does not offer residential services. It's not a housing benefit or something that focuses on housing. Instead, it covers healthcare services, including long-term services and supports. Some of those do have a residential component, but Medicaid is not going to cover any room and board. Individuals who are using a Medicaid service that includes a residential component will be financially responsible for those room and board costs. So it's just something that I think is important to kind of go into this keeping in mind. There are some services that can help individuals reduce some of the upfront costs associated with moving to a community setting. And then there's also some services that help a person make structural changes to the physical setup of their home that makes it more livable and more user-friendly, if you will, depending on a person's specific needs. And I'm going to go into all of these in a little bit more detail. Slide, please. So the first thing I'll talk about is transition assistance services. As anyone who's moved knows, there are upfront costs that can be barriers to people living independently, even if a person has the ongoing resources for room and board. It just can be there can be significant costs to that initial relocation. So that's where transition assistance services or TOS comes in. TOS is available to people in our Medicaid waiver programs. I won't go into a lot of detail about that, but just to make sure we're all on the same page, our waiver programs are for individuals who, if they were not enrolled in a Medicaid waiver program, would have to receive care in either a nursing facility, a state-supported living center, or an inpatient psychiatric setting. And so if a person is eligible for one of these programs and is transitioning from a nursing facility or institutional setting to the community, TOS can be used for things such as, again, those upfront costs that are associated with relocation. TOS is available statewide, and it is available to people in the Community Living Assistance and Support Services or CLASS program, the Deafblind with Multiple Disabilities or DBMD program, Home and Community-Based Services or HCS, Medically Dependent Children Program or MDCP, and then finally the Star Plus Home and Community-Based Services, which is the piece of the larger Star Plus program that serves individuals who otherwise would reside in a nursing facility. These services do need to be authorized before the person leaves the institutional setting that they're moving out of. So it is something that needs to be planned for in advance. It also is part of a person's waiver program costs. So each program has an annual limit to how much services can be reimbursed under that waiver. And TOS is one of those services. So if you are using TOS, that comes from that annual cost ceiling. Next slide, please. Some examples of what TOS can be used for includes security deposits for renting, establishing utility services, so those initial costs to set up electricity or gas. Buying essential furnishings. So these are not things that are necessarily decorative, but things that a person has to have, like a bed, a kitchen or dining room table, a chair, window blinds or curtains for privacy reasons. Um, Eating utensils and things like maybe a microwave, towels, bed linens, things of that nature. TOS can also be used for the actual moving expenses. So actually moving the furniture to the home where the person is going to be residing. And then also if there are services needed to make the home safe. So this might be something like pest eradication, or if someone has very intense allergies and needs some sort of allergen control done before they can move in. Um, a one-time deep cleaning of a setting before someone moves in. Those are also things that TOS can be used for. The dollar amount available for TOS differs by program, and again, it is part of the annual budget for that program. You can see on this slide the cost limits for each program. I want to note for the HCS waiver, which does have a residential setting option. If a person is moving to their own home or their family's home, their lifetime TOS limit is 2,500. If they're moving to one of those waiver residential settings, such as a 3 or 4 person home or host home companion care, they can still receive TOS, but it is limited to $1,000. And that's just because those settings are intentionally already set up in a lot of ways for a person to move to. And I'm going to talk about those settings a bit in a moment. Similarly, the Star Plus home and community-based services does not include TOS if the person is moving from the institutional setting to either the assisted living setting or adult foster care options that are available. So again, the idea is really that this service is available to someone who's going to be living in their own home or their family home for the most part. Next slide, please. So now I'm going to talk about some of the actual residential options in our programs. As I said at the beginning, we do have what are called waiver programs that are available to individuals that if they did not receive those waiver services, they would need to live in an institutional setting. So depending on a person's specific needs and which setting they would need to receive support from in an institutional setting, so whether a nursing facility or a state supported living center, is how we defer or how we refer to the waiver program. So IDD waivers or waivers for people with intellectual or developmental disabilities are targeting services towards individuals who would otherwise live in an SSLC. We also have nursing facility waivers for people who would live in a nursing facility. So if an individual is enrolling in one of the IDD waiver programs, we do have 2 of those programs that include residential components. The HCS waiver has small group homes. These are community-based homes, look just like any other house on the street. They are certified by HHSC and they can serve up to either 3 or 4 people, depending on the service that they are providing. Those homes are owned by the provider agency. So it is a provider owned and controlled setting. The individual is receiving the services they need from day to day in order to maximize their independence and remain in the community. In the HCS waiver, we also have what's called host home or companion care. This is a service that is similar in that it is considered provider owned or controlled, but unlike the small group homes where the staff supporting the individual are staff who are coming and going in shifts from the home, in host home companion care, the person responsible for the care actually lives in the home with the individual. So we see this often for adults who live with their parents and their parents are their host home or companion care provider. The difference between host home and companion care just refers to who actually owns the home. Is it the person receiving services or the person delivering the services? Otherwise, it's the same benefit, the same service that's being provided by the person being reimbursed. The deaf-blind with multiple disabilities or DBMD program includes the licensed assisted living option, which is as its name implies, licensed assisted living facilities serving up to 6 individuals. So these are smaller assisted living facilities. These aren't the big ones that someone might think of that look a lot like either a nursing facility might be attached to a nursing facility. These are not that. These are going to, again, similar to the HCS small group homes. These are look like just your average house on the street, and are fully integrated into the community. They do serve up to 6 people, though, so a few more people than in the HCS waiver. The Class Texas Home Living and MDCP programs do not include a provider-owned or controlled residential component. So those are programs where you're going to live in your own home or your family's home. Class and MDCP do have very limited options for some additional supports, but they aren't really residential components in the way that we talk about those in HCS and DBMD. Next slide. So in our nursing facility waivers, we have 2 of those. MDCP, which I just mentioned, does not include a residential component. We also have Star Plus HCBS, and it does. Star Plus HCBS is serving individuals who have either a physical disability or who are aging, and as a result, they need assistance with their day-to-day activities of daily living and additional nursing services that again, would require them to be in a nursing facility if they weren't in the program. So Star Plus HCBS includes 2 options. One is assisted living, and this looks a little bit different than the assisted living option in the DBMD waiver. Assisted living in Star Plus does include larger settings, so these could be serving up to 16 people and not just 6. It also could be an apartment setting. We have single and double occupancy apartments, and I won't go into all the details of that, but can certainly answer questions when we get to that part, where they are technically assisted living as well. So again, for all of these, the Medicaid service is the services and supports that are being delivered in the home. The individual receiving services is still responsible for the room and board associated with living in that setting. So next, I'm going to talk about minor home modifications. So this is a service that's available in all of our waiver programs, and it does allow an individual to make modifications to the physical space where they live that makes it more livable, safer, and allows them to be more independent. So minor home modifications might include something like widening a doorway so that a wheelchair can fit through it, modifying a shower so that it's a roll-in shower instead of a step-in or a bathtub. It might include installing modifying a sink so that someone can roll underneath the sink and it doesn't have that cabinet that a lot of kitchen and bathroom setups have. It is limited to the home where the person lives, so you cannot use minor home modifications if, say, you have a lake house that your family goes to for part of the year. It wouldn't be available for that. It needs to be the primary residence of the individual. If the person is renting, they can still receive minor home modifications. They do need to have permission from the landlord to make the modifications that are made through minor home mods. There is there is a cost ceiling on these as well. And again, these are waiver services, so these are part of the annual cost ceiling. In Class and DBMD, there is a $10,000 lifetime limit on minor home modifications. And then annually, $300 is available for just ongoing repairs and maintenance that's needed for these types of modifications. The HCS, Texas Home Living, MDCP, and Star Plus programs have a lower limit. They have a $7,500 lifetime cap, but that same $300 amount available for ongoing repairs and maintenance. One thing that is not listed here that I did want to note is adaptive aids. Adaptive aids are a little different than minor home modifications, but can be similar in some ways in how they can make a space more usable. So an adaptive aid might be something like a Hoyer lift or a phone, an adaptive phone that a person with either a communication difference or a physical difference needs so that they can use the phone. It might include a stove that has Braille options on it so that a person can use the oven and can know that they're using the right knobs and dials that go along with that. So different than minor home modifications in that these are not permanent changes to the physical plant of the home, but they are similar in what they can help a person achieve. And again, each of our waiver programs has an adaptive aids option. And the upside to adaptive aids is rather than a lifetime limit, it's generally an annual limit. And so there's a little bit more that can be available on an ongoing basis through adaptive aids. So I wanted to make sure to mention that, even though it's not always thought of as a housing or residential type benefit. And then the last thing that I'm going to talk about are our relocation specialists in our Star Plus Home and Community-Based Services, or HCBS program. Relocation specialists primarily work with Star Plus members who are transitioning to the community from generally a nursing facility and who do not have an intellectual or developmental disability. I emphasize that because a person who is moving into a program or who is going to be using community services that are related to an intellectual or developmental disability are going to receive assistance from the local IDD authority as opposed to their Star Plus managed care organization. So if a person is relocating to the community from the nursing facility, their managed care organization service coordinator is going to work with a relocation specialist to help that person with a lot of those same activities that we've talked about with our other services. But in addition, they can help that individual work out what their specific housing needs and preferences might be. Can they be in a second story apartment, or do they need a first floor setting? Is an apartment the right place at all? Or would a freestanding home be a better option for whatever reason? Do they have a place where they want to move? Are they moving in with friends or family? They can also help the individual apply for affordable housing through some of the programs that my colleagues have talked about and we'll talk about in a moment. And they also will help make sure that everything is in place for that person as they're leaving the nursing facility so that they have a successful transition and don't run into an obstacle that could have been prevented, but it wasn't. And so they end up having to transition back to the nursing facility. And then on the last slide, I just have some resources available. These are all email addresses for if you have any questions. We have a number of them because they're for each of our programs. But if you have any questions, you can feel free to reach out and someone will respond to you. We have someone watching these mailboxes all Monday through Friday during regular business hours. So that is all. Thank you.
We are next going to go to Tammy Miller from Local Access and Support to talk about housing supports available through the Aging and Disability Resource Centers, area agencies on aging, and independent living services. Thank you.
Good morning, everyone. As she said, my name is Tammy Miller. I'm the Senior Advisor for Local Access and Support. That's the area here within HHSC and Community Services where we house programs that focus on providing assistance to older individuals or those with a disability who need some type of support to live successfully within their community. For convenience, I'm going to share about all three of our programs, but then if there are questions, we'll have staff online that can answer questions or we can get back to everyone. So we're going to go ahead and move and start with our aging and disability. All right. Thank you for advancing that. Our aging and disability resource centers. So they're state designed entry points that ensure equitable access to long-term care services and supports, including housing related resources. So ADRCs, as we call them, connect individuals to existing federal and state and local housing programs through structured referral systems and resource databases. ADRCs serve individuals regardless of age, income, or disability, ensuring that a broad access to housing related information and referrals is available. Information, referral, and assistance option supports options, counseling, and referrals that enable individuals to transition from institutional settings to community living. Individuals can call 855-YES ADRC for a simple way to connect to the ADRC in their area. So our next program is our area agencies on aging, and they are local organizations that coordinate services and programs in the Older Americans Act for adults over the age of 60, their family members and caregivers. Triple A's provide information referral similar to ADRCs, but they also provide some additional things such as chore maintenance and residential repair. And these are services under the Older Americans Act Title 3B supportive services. So these services are intended to help older adults reduce the risk of institutionalization, maintain healthy and safe homes, support aging in place, assist older adults with functional limitations, and preserve independence and dignity in their home environment. So some examples of chore maintenance would be like scrubbing floors, washing walls and windows to make sure that there's a sanitary environment, moving heavy furniture so that they can ambulate safely, and perhaps cleaning dirt or debris in the yard so that they can get into and out of their home safely. Residential repair examples can be things like roof leak repairs, unsafe floors, essential plumbing, installing maybe a stove for cooking meals, heating and cooling to regulate throughout the temperatures that we have, especially here in Texas. And then other home modifications like grab bars in bathrooms, modifying bathtubs, or building ramps for wheelchair access. Chore maintenance and residential repair services are generally based on available funding, priority of need, and health safety risks. And I want to note that for residential repair, cosmetic or beautification projects are strictly prohibited. An individual looking for a AAA in their area simply has to call 800-252-9240. They enter the zip code and they will be connected with the AAA that can help them wherever they're at in the state. And then our last program in our area is the Independent Living Services Program. This program helps people with disabilities live more independently, make informed choices, and participate fully in society. This is rooted in the Rehabilitation Act of 1973, and ILS supports the philosophy of consumer control, peer support, self-help, self-determination, equal access, and individual or system advocacy. ILS provides services to Texans with significant disabilities through the Centers for Independent Living, who offer purchase services, core services, or both. So purchase services helps people live independently in their home, in their community. The goal is to avoid nursing home or other institutional settings if that's not what the individual is looking for. So ways that this can be accomplished is home modifications similar to the AAA program. ILS can get consumers a personalized assessment from either a physical therapist, a rehabilitation engineer, or another professional to determine what is needed and what needs to be modified. So some examples would include, again, wheelchair ramps, environmental control units, stair lifts, door widening for wheelchair access, and making bathrooms more accessible. And in our core services program, ILS provides resources to assist people with housing and individual independent living needs
through advocacy. So this may be like acting as an intermediary with their landlord or housing authority. It's also about self-empowerment relating to working with consumers so that they, one, understand their right and what they can do to advocate to get the housing that they need and want. The easiest path to locate a Center for Independent Living is to go to our website, which is hhs.texas.gov. You go to services and select disability. You'll go down and find all of our Centers for Independent Living. That page will give you their contact information as well as the counties that they serve. And those are our independent living services, AAA, Area Agencies on Aging, and Aging and Disability Resource Services programs. And that's my contact information. If you need anything, we'd be glad to get you to one of the appropriate programs to answer your specific question. There's the contact. Thank you, Claire.
Wonderful. Thank you guys so much. Well, thank you for joining us today. For our last slide, we've provided some additional resources. First, our No Wrong Door homepage. This includes a definition of our No Wrong Door system and links to many of the offices that we've talked about today. You can use search functions to identify the local office closest to you. Many of the things that we talked about today have various criteria for eligibility, various quantities of available. So the best thing that you can do if you're interested in one of these things today is to go through one of those no wrong doors, the doors that might be a 211 office, or go into or call an LMHA to inquire about these specific services. Because you must be determined, the criteria, you must be determined eligible to meet for these various supports and services and waivers. We also included, next in partnership with the Texas Department of Housing and Community Affairs, we've included the two main housing resource pages. First, Help for Texans and the Vacancy Clearinghouse. This is located on the Help for Texans webpage, but sometimes the Vacancy Clearinghouse can be overlooked. And for some, this could be the most helpful resources the public can use to find their own affordable apartment. Next, we worked with our GCPD, ex officio, and the Texas Workforce Commission, who agreed for the inclusion of their fair housing resources within TWC on this final slide. Within TWC, they have a civil rights division that enforces the Fair Housing Act and protects people from discrimination when they are renting or buying a home, getting a mortgage, seeking housing assistance, or engaging in other housing-related activities. Visit the link on the screen above to file a complaint, seek training for housing providers or property managers, and sign up for monthly webinars. Today's presentation is intended to close the gap by highlighting key resources and clarifying how these pieces fit together. Our goal is to ensure that you leave with clearer direction and information on where to go for specific needs, even when responsibilities and resources can be spread across agencies. We heard from many different people, even in just HHSC today, that have some sort of housing coordination and support. Please contact us at the contacts available in each slide deck, and we'll have a final contact at the end if you just need a place to get started. This concludes our presentation today. However, our divisional experts have remained on the line for some additional questions, and we'll move to those now. Kelly?
Hey everybody, I'm Kelly Carlson and I work in the Office of Disability Services Coordination. We had a number of questions come in through the chat, so I'm going to pull those up and ask those to our presenters who can hear the answers. Let me scroll through and get to the top of that list really quick. Okay, so the first question came in and asked if North Texas Behavioral Health Authority was able to provide rental assistance. The person had been told they had discontinued that program, so I'll pass that to Libby.
North Texas Behavioral Health Authority is currently a provider of supportive housing rental assistance, so they should be able to provide those services in their catchment area.
Awesome. We also had another question about whether LMHAs keep a list of group homes that are accessible for deaf and hard of hearing residents who communicate in sign language. They felt like that would help ease the risk of being isolated in a home where no one can communicate. We also had a secondary question that was sort of similar, whether there was a group home for the deaf. Somebody had been told the one in Austin was closed. There was a third one about whether there were group homes where all staff and clients communicate in ASL only. So I'm going to kind of group those three questions together for you, Libby, and also maybe for Kate.
So great questions. The local mental health authorities do not oversee any type of group homes. We don't run the group homes. And the local mental health authorities and behavioral health authorities are not required to keep any kind of list. All that being said, though, the local mental health authorities are going to be the experts on resources available in their area. And so they should be aware of group homes in the area. Specifically for those hard of hearing, if they're not aware of any specific homes designated or that have folks who are hard of hearing in the home, they can help connect to resources like 211 or other supports to help meet individuals' needs in the community. That's definitely something that the LMHAs are able to do.
Awesome. Thanks, Libby. And Kate, I'll let you jump in.
Yeah, so for the waiver programs, the one of the underlying requirements is that an individual have choice of where they want to live and which home they live in. So it's not a provider would not be able to say this home is only for a person who uses ASL or who is deaf. Now, in the DBMD program, of course, the eligibility criteria are that a person be both deaf and blind and have a third condition. So those settings are automatically going to include individuals who are who are deaf, although because of the vision component of the eligibility, ASL isn't always going to be what their communication modality is. That doesn't mean that a provider, if an individual, when they're choosing those homes, if a provider has, for example, staff that are very skilled in using ASL or another communication modality, that might not be an appealing home to someone who has that need. So there are ways that a person could seek out a home where they might have more support. And the idea is that those needs be met. So even if there's not a home that is specifically for individuals that are using ASL or that have a specific diagnosis or need, that provider is required to meet whatever the needs are of the individual. So hopefully that helps answer.
Yes, thank you so much. There was a follow-up question I think that you'll maybe be able to help answer, Kate. They asked that if there was no deaf space for group homes, is there a guide or way to implement or set up a new group home that maybe focuses on visual language in a safe space? And there's a little bit more to that context about it could be for a mental health program, disability development program, autism program, and deaf blind program, maybe set up for separate group homes under one company and foster the professional collaboration in Texas.
Yeah, so I can only speak to Medicaid, and again, the requirements under the waiver are that a person have choice of a setting. So if there is a group home that is available that has a space and a person who does not have deafness or blindness wants to live in that home, they have to be able to choose that home. And so it's difficult to say with certainty that a provider would be able to, through one of the Medicaid waiver programs, to limit that residence to just a specific a specific type of need. Another thing to keep in mind is that with the home and community-based services settings requirements, there are limitations on, I'm not entirely sure with the 4 separate group homes what kind of collaboration is being referred to, but in order to maintain that community-based nature of the home, there are limitations on where homes can be in relation to each other physically, how many can be within X number of miles, can they share property, etc. So I would definitely encourage, if someone is interested in opening a home, reaching out to HHSC early and talking through with either my team or with our regulatory side what you might be interested in and what options might be available to you.
Thank you, Kate. I appreciate that. So we've had a few other questions come up, so I'm going to go through those. Let me scroll through. So we had a question, the Section 202 HUD Senior Affordable Housing is a great option for seniors that are low income. And this person has noticed there are no new builds of these types. And the question was, has this program discontinued in regards to new builds? So I'm going to have Claire step in and talk through a little bit of the resources to reach out about that.
Claire, this Section 202 program is likely with TDHCA, or the Texas Department of Housing and Community Affairs. And even still, it might actually be operated through them. We see a lot of HUD programs and funding coming at a federal level, but we would recommend starting with the website for Help for Texans and contacting TDHCA to further inquiry about that specific program.
Awesome. The next question we had come in is, who do we recommend we can speak with at the local mental health authority? So Livy, I'm going to pass that question to you.
I'm coming. Sorry, Kelly, can you repeat the question?
Yes. So the question was, who do you recommend we speak to with at the local mental health authority?
In regards to,
I think it was related when you were covering the different options earlier in the Q&A.
So in regards to like figuring out what group home options or whatnot, you'll have to be go through an intake, receive the uniform assessment. It'll determine your level of care, and then they'll connect you with a case manager. Your case manager is going to be one of the best people to help identify local resources. If you're not wanting to connect with the local mental health authority, I think 211 would likely be one of your best options to help figure out what resources are available in your area.
Awesome. Thank you, Libby. And then we had another question, or I guess a comment. And so Aaron, I'll thank you for that. He had the kind of question about the different group home model. And he just gave a link for a similar model that's potentially applicable in Minnesota. And I'll share that link, Aaron, with our panelists. So thank you for that. I'm scrolling through. Okay, we had a question for the panelists that says, I noticed for the SHRA, a mental illness diagnosis is required for eligibility. They were wondering about LMBAs and people who have behavior disorders. Would they be eligible as well? So Livy, I'll pass that to you.
I think as long as they're connected to their local mental health or behavioral health authority and have some type of mental illness diagnosis, they should be eligible for the program. If you've got specific eligibility questions, you're welcome to send them my way.
Awesome. Okay, let me keep going through our questions. So we had a question that said, for each of the services mentioned today, is there a waiting list? And if so, approximately how long is the wait? So I think that's going to be individual to each of the things shared. So I think we'll start with Libby and the BH folks and have them talk about their different programs. So that's Libby, Yvonne, and Brittany, I'll have you guys kind of go first, and then we can kind of go down the list to talk about that.
Yeah, I think for specific program waitlist questions, again, that would be best emailed to our adult MH at hhs.texas.gov, and we can help answer any specific questions. But generally, all of our programs do have the potential to have waitlists.
And then I'll just piggyback on what Libby said, reaching out to the exact HCC provider. Each provider runs their HCC a little bit different. So we have some that are more crisis based, and then they have the transitional to permanent housing model. We have some that, like Libby said, they'll do the coordinated assessment, assess which program is best for their need, and then they'll go from there. But you can still get connected, even if you're not, for my program specifically, even if you're not housed, they're still able to provide a certain amount of resources and support to you until they can get you in. And so, yes, reaching out to each individual one to figure out what that process is. But I know there's a couple that don't have a wait list right now. And so it's just kind of depending on the area that you're in as well. So yes, reaching out to the provider, I think, is the best.
Brittany, I didn't know if you wanted to share something different for contact or information about wait lists.
Sure. So for Section 811, it's best to go to that Info 811 site and inquire because they are property specific. Project Access, the mainstream vouchers that I mentioned about, there's a little bit of a wait list for them, but I know they're actively working through it. And for the pilot, so individuals that are exiting the state hospitals or have in the past 60 days, there's actually no wait at this time for the Project Access pilot referrals.
Awesome. That's great information. Kate, I don't know if you want to speak about the information you shared about potential wait lists.
We do have, I apologize. What, can you repeat the question?
So there was a question asking for each of the different programs, are there wait lists or is there the potential for wait lists? And if so, how long? A lot of everybody else is kind of saying, well, there could be, and you can email for specific information. So yeah.
Yes, absolutely. So for the Medicaid waiver programs, yes, we do have interest lists for the programs. Now, once you have enrolled in the program, we do require that providers make services available to you when you need them. And so obviously there can be some time, but generally speaking, to use the HCS waiver as an example, if someone enrolls in the program or is already in the program and wants to live in a 3 or 4 person home and the provider doesn't have a space available, they must create a space within generally it's 90 days in order to provide a space for that individual to be able to receive that service. The interest lists for the programs can be rather long. Now, if someone is transitioning from an institutional setting, there are different options depending on the program that they're transitioning into, where they might be able to bypass that interest list and go straight from the institutional setting to the community program. But for certain, if someone is even thinks they might be interested in any of the programs, we would encourage them to get on that interest list as soon as possible so that they can have the best chance of being able to access services when they need them.
Awesome. Thank you so much. And then Tammy, if you want to talk about ADRCs, triple A's, and the SILs.
I think it's going to be the same as I said. Yeah, it's available funding, eligibility. They prioritize. So there's not a formal interest list, wait list type thing. I would encourage individuals to reach out. Even if, they can't help you at the moment, I would still encourage always to reach out.
Awesome. Thank you. And then we had a question, I think that's a little bit about clarification for Libby about why mental health authority is in charge of group homes. And I think you had provided a little bit of clarity about the role of the local mental health authorities. So I didn't know if you wanted to just give a little more clarity about that.
The local mental health authority doesn't contract with any group homes. They have HCBS, AMH group homes, but that's a program outside of my area. But if you need more information on that, you're welcome to email me and I can get you connected with the program. But HHSC doesn't have oversight of local group homes.
Awesome. Thank you so much, Libby. Okay, were there any other questions? I don't see any other ones coming in through the chat. I'll give just a second and then I'll hand it back to Claire.
Well, thank you so much to so many of our HHSC providers. As you guys have witnessed today, housing can have lots of tethers and lots of different places. And even just with one agency, we've had multiple services, supports, waivers, areas across just HHSC that is presented today. I dropped a link in the chat for everyone. This is our No Wrong Door page. This starts to talk about some of the offices that we talked about today and the supports that they provided. And I'll reaffirm what many folks have already answered as well. The best place to get started is calling or being at those intake type of processes to determine what you're eligible for, what needs you have, and to start from there. So with that, I think we can conclude our presentation. I'll hand it back to Matt. Thank you so much for your time today.
Okay, thank you so much for coming to join us today. I know that it was a lot of information to take in, but it's all very important information and it's very helpful for many individuals. So I hope you all had a nice time learning about all of this, and it's recorded, like I mentioned before. So we will have a PowerPoint available for you to look at anytime. So again, because it is a lot of information, it may be beneficial to review again later. So I'm going to go ahead and close the meeting. I do want to extend a big thanks to all of the presenters today. Thanks for this wonderful information. So again, please do the survey if you have a chance to. Thank you so much and have a wonderful rest of your week.